Guys, welcome back to the channel. I am Dr. Pavitra Shankar and okay, there is some crazy energy in the air because procrastination is at an all level high. You would think कि बंदा बड़ा होता है, responsible होता है, बड़ा type डॉक्टर साहब बनता है. But here's what I've realized: being lazy is difficult, because you stay hear me out, okay? You stay in a state of constant guilt. You want to do a lot of things, your mind is never at ease, but you're still not doing anything. And it's a cycle, it's a traumatic cycle. And if I talk about it in like psychiatric cognitive terms, it's like a vicious cycle where there are all these cognitive distortions कि भाई मुझसे तो ये भी नहीं होगा, I am useless, I am worthless, and then I don't initiate any action, and then that is a proof of my thoughts that I'm actually not able to do anything and that I'm good for nothing, but you still stay in that state, you know. I don't know if it makes sense, but yeah. So, okay. Hmm. I don't know the point of this video, but the thing is, we're trying to be regular making videos, and being a doctor is funny because I'm reading all these news of, this recently hua that a medical officer on duty was almost was like threatened and asked and questioned about his medical acumen and clinical acumen by someone who was in a Whiteful Bar maze, and not at all someone who was qualified for taking any of those decisions, but then still there is so much of dadagiri that's going on, and you would think कि यार डॉक्टर साहब बनके in India it's a position of privilege, but it's pretty much not. Yeah, so like uh, and like what exactly is expected from us here, right? So they say it's a noble profession, it is a noble profession, but then it is still a profession, right? Are you not, and in any profession, do you not do it at the end of it to sustain yourself? um like, do you not deserve having like a salary or any like monetary um, profits from it to sustain your life? Or is it just that being a doctor means things are given to you free of cost, that your groceries will be free or your house rent would be waived off? No, right? You still have to pay for all of that. Then why is there this expectations that doctors should work for um, should just give consultations and should not worry about money? And I understand that there's a lot of unethical practice that's going on, but the fact that it is so scary ki, since I have just very recently shifted from a public setup to a private setup, it does. Every time I see that a patient comes in my cabin and they have paid before and they show me that they paid before and they show me that a receipt, there's a there's an instant sense of guilt, as if like, don't show me that you've paid money for it, or it's not important, but okay, it is important, and it is, I am giving an expert advice, something which I have earned. So and so it's not just that public or the non-medicals expect us to give advice for free, or to sort of provide us services for the bare minimum, but it's also somewhere ingrained in us that because it's a noble profession and it's because you're serving the people, that you're not supposed to expect any monetary benefits, or even like the basic consultation fees, which is like a right for of you, obviously within reasonable limits. It's sort of like a taboo to talk about these things, and maybe that is why we're not able to like standardize consultation fees, and we're not able to come to like common prices, and that's why maybe it's one of the reasons that uh, While someone might charge 300 bucks for a consultation, someone else might charge 3,000. Yes, years of expertise do matter, but then the fact that we try to hide these things or not talk about this, and there's not an open conversation about it, I think it is one of the reasons why there is so much of a discrepancy, and why there are some doctors who are hardly affordable, and then there are some doctors who are affordable, but then a patient might feel like they're compromising on the quality of healthcare that they're getting. So ना तो uniformity है in the training as doctors, ना uniformity है in the healthcare services, ना the standard of services between private and public, it is so different. The availability of services is so different. What are we doing, man? I don't know. It's just something you don't have to take personally. It's a rant, maybe. I don't know. I read a lot of things in this video. Do you agree to any of these? Do you have any idea how to calm myself down? And honestly, do you have any idea what I can do to get out of this laziness? I know I'm a psychiatrist. I know I say all of these things to many people on a daily basis. But यार बोलना बहुत आसान होता है. Honestly, I'm in this state of mm, not knowing what to do after 5 p.m., not knowing like I because I've only known working and studying constantly till now. So there's a lot of free time in my hands, I guess, right now. That's it. And khali dimag shaitan ka ghar hota hai. Okay, bye. See you next week.